Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Thank you to our platform sponsor, J&J, for their unrestricted support of PH Insights. Sponsors do not endorse or participate in the development of program content. Hi, my name is Angela, and welcome to this latest episode of PH Insights. Joining me today is Colleen Connor, who knows well the benefit of receiving care through the PHA Care Center network. The PHA-accredited Care Center program is an initiative launched by the Pulmonary Hypertension Association in 2011. The PHA Care Center network provides patients and their families with direct PH care, identifies gaps in patients' needs, and brings together additional resources in one space. Colleen, thank you so much for joining me. I would like to just take this moment before we get started to allow you to introduce yourself and share some of your journey with PH.
Oh, thanks, Angela. It's wonderful to be here today. I'm Colleen Connor, and I've been living with pulmonary arterial hypertension for nearly 20 years now. I do serve on PHA's Board of Trustees, where I've had the privilege of serving for the last decade, soon to be rolling off. And I also serve on the American Board of Internal Medicine, the Pulmonary Disease Board as a patient representative, and on the PHA Registry Steering Committee as a patient. You know, I was diagnosed with pulmonary hypertension while really my journey started in 2004, shortly after having my daughter. And like many patients, my path to diagnosis, it wasn't straightforward. I looked completely normal when sitting down, but I was increasingly becoming more and more short of breath anytime I moved. And I didn't know how to properly describe what I was feeling. I just kept telling doctors that I couldn't breathe when I walked, or when I walked and talked, or sometimes when I just talked. And so for 2.5 years, I went to several doctors, being told everything from I had exercise-induced asthma to I just had anxiety from juggling a big job while caring for my 2 young children. And so it did take several years for me. It wasn't until 2007, 3 years later, that an echo finally revealed that my heart pressures were many times above normal, showing severe pulmonary hypertension. And I'll never forget going home and Googling PH and finding the devastating life expectancy of just 2 to 3 years at the time. And my children were only 3 and 7 years old. And back then, a PHA-accredited care center network didn't exist. And it took me some months to find PHA. But once I did, PHA really became my lifeline, Angela. You know, back then, there was a Find a Doctor directory and a survival guide that were really crucial in helping me find the appropriate care to navigate PH. And also, I found support through PHA support groups and online discussion forums and the international conferences. And I still go to the conferences, and I still also regularly participate in support groups where I have a lot of meaningful friendships that I've formed with other patients and their families. And, you know, personally, I'm indebted to PHA for the guidance, the education, and the community they've connected me with. And it's inspired my deep involvement with PHA. Even today, I co-lead the University of Pennsylvania PHA support group, and I participate in advocacy work. I've spoken at congressional briefings and on an FDA panel, and I've seen firsthand how the critical specialized care and support are, which is why I'm so really passionate about the work of the PHA-accredited Care Center program.
Yeah, thank you so much, Colleen, for sharing your journey, sharing your story. I will say that the feeling is mutual with the impact that you have had within the pulmonary hypertension community, working through PHA and on your own, the work that you've done. You've kind of summarized, but it's significant, the contributions you've done for even the conference last year, we had PHA 2024. You were on the go 24/7. I know you led some sessions and, worked through patient education, but I barely saw you. You were you were everywhere, and you wanted to do that. You wanted to be able to share that information. So I truly appreciate you. You are an asset to PHA as well. I want to add also, just can't imagine the limited amount of resources that were available at that time. We still have people who just Google PH, and they're bombarded with either misinformation or limited information or trying to weed through the resources. So I'm really, really appreciative that you mentioned the PHA Care Center Network, because I want to focus in on the conversation there, because I think it's important for our patient community and for our listeners. How did the PHA Care Center Network come about? How did it start?
That's a great question, Angela. And let me first say thank you for your sweet comments about conference. I truly enjoyed running around and as best I could on my scooter. So not really a run, a trot, right? But I really appreciate the opportunity to share just the exciting things that are coming down the pike with PHA, because I found truly when I was diagnosed, my first conference was 6 months after, and I went there and I just learned so much and I made so many connections, and I can't underestimate the impact that had on the choices that I made and the direction that my care went in from attending the PHA conference. So definitely want to just give a plug for the next conference, people to really consider attending that. And so you were asking, how did the PHA Care Center Network come about? And that program grew out of a real need that both doctors and patients were seeing across the country. So back in 2011, PHA Scientific Leadership Council recognized that we had a significant challenge. Even though we were making some progress with new treatments for PAH, patients were still facing really major hurdles. There were significant issues still with PH diagnosis and treatment. Patients had limited access to PH expert care. And the average time from when symptoms were starting to getting diagnosed was, still about 2 years. And many patients would see 3 or more doctors before getting the right diagnosis. So the PHA-accredited Care Center Program initiative was created really to address those challenges head on. So, think of it as establishing centers of excellence specifically for PH care. And the centers have a couple of fundamental goals. One is to increase patient access to care. Another is to provide focused education for both patients and healthcare professionals. And then also to promote consistent and high quality standards of care. So what makes it meaningful is that it's a long-term impact and commitment. The centers are working towards earlier diagnosis of PH. They're working towards improving the overall patient care and outcomes, and ultimately contributing to finding a cure. And they're not just treating patients, they're also participating in a patient registry called FAR, which helps track the quality of the patient care and the patient outcomes.
In researching and preparing for this episode, I've really learned a lot about the Accredited Care Center program that we have here. So it's really opening my mind to the work that we do throughout our organization and how we come together to make this known throughout our community. Do you have an example of the additional services a patient may need that the care center provides?
Oh, absolutely. So one of the most valuable aspects of a PHA designated accredited care center is that they take a comprehensive approach to patient care. So a real world example would be first, that these centers have the expertise and the equipment for the advanced PH diagnostics. So it's crucial because the proper diagnosis often requires specialized testing that might not be available at someone's local hospital or their local clinic. So that's one piece of it. what I really think sets PHA care centers apart is how they coordinate the full spectrum of your care. So when you're dealing with pulmonary hypertension, you often need more than just one medicine. You might need support with things like an exercise rehabilitation program. You might need help with managing side effects or assistance with oxygen therapy. And PHA care centers are designed to identify these needs and help bring in the right resources for you. And it could be a nutritionist or a social worker or a specialist in another area. And I think it's a huge advantage that they understand what it means to treat the rare disease of PH. They get to leverage their experience because they treat many patients. So they leverage that knowledge of their patient experience to anticipate what your challenges would be and what the solutions could be. And the centers also understand practical challenges that we face, everything from, like I mentioned, managing multiple medications to navigating insurance coverage. And they often have support staff who can help with these critical aspects of trying to live and cope in the world of PH.
Yeah, I'm sure that this was extremely helpful as you navigated your diagnosis, discovering that treatment plan, figuring out, what exactly will work for you, and then having a dedicated team to, improve your quality of life, but also the people who visit the center. Everyone has different needs. So thank you for sharing that. As we discussed the PHA Accredited Care Center program, why should someone look for this in their area? How can they benefit more as a patient by attending one?
Yeah, that's a great question. And it's something that I feel really passionate about, Angela. Let me share why I think the centers are so vital from my own personal experience. So I've been living in this world of pulmonary hypertension for nearly 20 years. And over the years, I've known several fellow patients who were struggling with their PH, and they were believing that they were receiving all the available treatment options, when in fact, they were not being offered some of the most effective and like the gold standard therapies at the time, like continuous intravenous treatments. And, several of these friends had devastating outcomes that might have been prevented if they had access to comprehensive care. And so when you choose a PHA care center, you're choosing a center that's been thoroughly vetted and accredited. It means that they've experienced providers, that they understand the complexities of PH, they have the facilities that have the right capabilities, and they have access to the latest clinical research and treatment options. And it's more than just the medical care. These centers also offer a complete support system. And what really excites me about PHA's care center is the commitment to continuous improvement. So a lot of the centers participate in the registry, which means they're constantly learning and evolving. And they're evolving in their care based on real patient outcomes. And as patients, if you go to a care center, we get access to their support groups, and there's often opportunities to participate in research if we choose. And honestly, it's a peace of mind knowing that our care team is up to date with the latest advances in PH treatments.
Like I mentioned earlier, I did have that pleasure of working with you at PHA 2024, and I've seen that passion firsthand. And I've seen that passion from some of our experts who work within the care centers. They've been on this show. They provide patient education through our webinars, our classroom videos. So the people who are within this work are really dedicated to continuous improvement. And so I really want to touch on something you mentioned there. You mentioned FAR, or the PHA registry. Can you elaborate a little bit more on that and that continuous improvement piece?
Absolutely. So the PHA patient registry, we call it FAR, like PHAR. It was developed to measure the quality of care metrics and patient outcomes in order to help the care center's goals and to also advance research. Again, I'm really passionate about it because also early in my journey with PH, before these PHA initiatives, I experienced firsthand how powerful registry data can be in making life-changing treatment decisions. So when I was facing the possibility of transplant, it was registry data from a now outdated, no longer maintained registry, but it was registry data that was available at another center that my PH team consulted with that provided crucial information about my prognosis. And the question was whether or not I get a lung transplant at that time. And the information that we were able to glean literally changed the trajectory of my life. We had decided at the time it was not the correct time for transplant for me. And I just can't stress enough, like, the importance that, it was probably the most important decision I've ever made. And today, the PHA registry is the largest active PH registry in the United States, and it's making such a big difference in how we understand and treat the disease. And when a center becomes accredited, they're invited to participate in the registry. And it's remarkable, Angela, about 85% of the PHA care centers choose to participate. The numbers are really impressive. It includes clinical data for more than 3,500 patients with various forms of pulmonary hypertension, including PAH, CTEPH, and pediatric PH. And the data has supported over 50 research projects and multiple studies and 18 published papers. And every single piece of research helps us to better understand our risk factors, improve the quality of care, and to develop new treatments. So I'm pretty excited about the registry.
Yeah, I couldn't agree more. I think that it's very, very important to how we move forward with the pH. And you even can recognize that if you are a listener. We had 2 episodes last year about the research that PHA has supported over the years. So please take a moment to go back and listen to those episodes, because it's really important. The more we know about pH and how it impacts patients from all walks of life, the better we are equipped to understand pulmonary hypertension and to make those improvements to treatments and quality care, like you mentioned. And you also said about 85% of PHA Care Center programs participate in FAR. So I'm curious, how many centers are there across the United States?
Angela, great question. And I'm really excited to share that we now have 99 accredited PHA care centers across the country, with an additional 20 programs that are currently undergoing the thorough evaluation process for accreditation. And our numbers are comparable with other rare disease registries, which is really impressive for a 10-year care center program. We just celebrated the 10-year anniversary of the PHA accreditation program last year. And what's really encouraging is how the network continues to grow. And really strategically, PHA is being very thoughtful about expanding accreditation to ensure that we're offering good geographic coverage across the United States. We're also putting a special focus on increasing the number of pediatric programs in the network, which obviously is really crucial for families dealing with children diagnosed with pulmonary hypertension.
I've learned a lot in researching and putting together this episode, but I think I'm learning something absolutely new here, that there are 99 centers with 20 more awaiting inclusion. I don't think that gets talked about enough within our organization and sharing out to our community. So thank you for mentioning that here, and kudos to our accreditation team for pulling in additional centers to address the issue and be there for the PH community. So is there anything else that you feel is important we should know about the PHA Care Center network?
Yeah, something that's not talked about that I feel is critical is that I can't stress enough how these care centers are actively working to transform PH care across the country through quality improvement. When you track how patients are doing in a registry, then you can report on it. And I've seen the data reports from the registry that show how patient hospitalizations have decreased since being tracked from January of 2016 through July of 2024. I saw another chart that demonstrates how patient deaths have declined. And, it's the PHA Care Center network that ensures this quality care. And the patient registry is how the data is tracked and proves that patient care is high quality and it's continually improving. So PHA uses these registry reports to drive the quality improvement. And let me share an example of how it works. The Scientific Leadership Council calls it kind of the plan, do, study, act cycle. So as an example, one center discovered through the registry that they were below the national median in evaluating patients fully for CTEPH. CTEPH is a type of pH that can potentially be reversed through surgery. So it's really critical that everyone fully go through all of the testing steps to diagnose this type of pH, because missing this diagnosis means it could be missing an opportunity to cure a patient potentially. And these care centers can see how they stack up against other centers. And they, one center was able to identify that they had a gap and that they weren't fully testing everyone. And they were able to see that their evaluation rate went from unacceptable in 2018 from about 60% of doing everyone's testing, and they improved it in just a few years to 75%. And now they're better than the national median of care centers in making sure they do the full testing. And so care centers are continually learning from each other and from the data that's in the registry, and they identify areas for improvement, and then they are all elevated across the board. Every time they get reaccredited, they learn from it, they implement new strategies, and they move forward, and it elevates the care for all of us. So for anyone listening who has pulmonary hypertension or who knows someone with pulmonary hypertension, I want you to know that these care centers represent our best path forward. They're combining the expert care, the education, the research, and continuous improvement to give patients their best possible chance at a better outcome.
Now, how do we find access to a care center? For those with PH, or if you know someone with PH, how do you know if you're close to one, if you live near one, and you could be a patient there?
Finding the right care center is one of the most important steps a patient can take, and there are several ways to do it. You can reach out directly to one, or you can work through your healthcare professional. You can go through your primary care physician or a specialist, like your cardiologist or your pulmonologist or your rheumatologist. And any of these types of professionals can help coordinate a referral. And if distance is a concern, and look, I know it is firsthand for many patients, please don't let this be a barrier to getting specialized care. Many centers now offer a hybrid care model, maybe an in-person visit with telehealth appointments in between. Also, your local healthcare providers can collaborate directly with a PH Care Center team to ensure that you're getting coordinated and expert care. PHA's website has the directory of it, of the 99 accredited care centers across the country. And think about using the patient support line to help you find the center that might fit your location and situation. And they can also discuss options for managing long distance care and connect you with the right resources to make it work. And just remember that these centers are continuously improving their care through shared data and best practices, ensuring that you get the most current evidence-based treatment available. So please don't hesitate to reach out and taking that first step. It can really make all the difference in your PH journey.
Absolutely. Thank you for giving and providing this overview of the Pulmonary Hypertension Association's accredited care center network and this initiative. I know how important it was for your care, and I'm sure it can definitely benefit others in the future. To me, and I feel like I say this all the time, but it's so crucial and important for me to have guests on like yourself who are actually living with PH. And I mean that in so many different ways because you are living. You're still able to have that life while living with pulmonary arterial hypertension. So thank you again for sharing that journey. For so many who are newly diagnosed and their first instinct is to go to Google and they're hit with all of this overwhelming information, they now have this resource of PH Insights to kind of help them navigate all the information that they'll see, and to have you here sharing your journey. I really, really appreciate it.
It's my pleasure to share about the PHA accredited care centers and the registry and their role in PH care. For anyone listening who's newly diagnosed or feeling overwhelmed, please know that we recognize this journey isn't easy. It's become one, I think, at least for myself, that I have so much more hope than when I started mine nearly 20 years ago. I've been on oxygen 24/7 since I was diagnosed, and I had IV therapy for 12 years, and I've survived breast cancer and all of these other things. And when I thought the cards were stacked against me, and here I am today. And the landscape of PH over my diagnosis journey has really transformed dramatically. And one of the biggest things I see is these specialized centers. And when I was diagnosed, my future seemed bleak. And thanks to specialized care, advances in treatment, the collective knowledge being gathered through these care centers and the registry, I've personally had the great fortune to be able to survive and watch my children grow up and begin to build their own independent lives. And I want listeners to take away today is that connecting with a PH care center isn't just about accessing medical expertise. It's about joining our community that understands the disease and is actively working to improve outcomes for all of us. So no matter where you are in your PH journey, there are people here ready to support you, and there are resources available to guide you. And there are ongoing advancements being made continually. So I feel like the path is so much clearer today than it was even a decade ago, and certainly more than 2 decades ago. And it gives me tremendous hope, not just for my future, but for all of us living with pulmonary hypertension. So I just want to thank you for allowing me to be a part of this really important conversation, Angela.
Thank you, Colleen, for sharing a part of you, and then also just this information that's really, really important. I hope that you will be a continued guest on the show. I feel like you have a beautiful story and journey to tell, and I invite you to come back anytime you would like. Anytime an idea sparks and you're like, hey, let's talk about that, just say it and it's done. But I really appreciate you being here and sharing your story, and hopefully you'll impact others to reach out and find a care center in their area. If you would like more information on the PHA accredited care center program, you can go to find a center in your area at phassociation.org/PH Care Centers, or just search care centers on our website and it should pull you to that link. But thank you again, Colleen. I really appreciate you coming and lending your voice to this episode.
Oh, thank you, Angela.
All right, everyone. You have a great day. Bye-bye. And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. And thank you to J&J for their unrestricted support of PH Insights.